Urinary system. This coincides with what we are discussing in 162 special procedures. So as usual, let's go ahead and begin with the anatomy. So the urinary system consists of 2 kidneys, 2 ureters, 1 urinary bladder, and 1 urethra. We have the suprarenal or adrenal glands, also located in the kidneys, above the kidneys actually, but it's not part of the urinary system. Excuse me, it's part of the endocrine system. Okay? Any questions so far? All right. The relationship of the kidneys is to the posterior ribs are demonstrated. So what we have here is the back side, the posterior view of the kidneys, and you can see that they are located in the back. Those who have issues, especially if they're having stones or they have any type of kidney infection, they're not feeling it here, they're not feeling it down here, they're usually feeling it in the back, and it feels like they've strained their back, or it feels like someone's punched them there. So that is their location. So you can see that it's in the back of the kidney, also in the back of the spleen. This is the kidneys, the very middle part of the kidneys is located at the level of L1, L2, which is going to be significant in trying to localize those kidneys when taking a radiograph. So L1, L2. They are bean shaped. They are located on both sides of the vertebral column, and again between L1 and L2. Okay. The kidneys and the ureters are retroperitoneal structures, very posterior, and then below the peritoneum are your infraperitoneal structures. That includes your distal ureters, your urinary bladder, and then the urethra. Now, this is also important here. I put this down here on the bottom. This is also on your slides. But the ureters exits the kidneys anteriorly. So they exit the kidneys anteriorly. They do hug the lumbar spine. As you can see here, it does hug the lumbar spine. And then they enter the bladder on the back side of it. Okay, they enter the bladder on the back side of it and also laterally. So it's posterolateral. Okay, so the ureters enter the bladder posterolaterally. You guys remember the psoas muscles? Okay, you see the psoas muscles on your KUBs, right? The psoas muscles are what allows you to bend. Okay, it allows you to flex your hips. They're also called the hip flexors. And that muscle is very dense and can be seen radiographically. And because of those psoas muscles, it also is involved in how the kidney is oriented or positioned. So what happens here is that the psoas muscles causes a 20-degree vertical angulation from the mid-sagittal plane. So it angles it this way, okay, about 20 degrees. Okay. The upper pole of the kidneys puts the upper pole of the kidneys closer to the midline, whereas the medial border is also going to be more anterior. So not only are they like this, okay, so they're like this, but what happens if we're looking at it from the bottom up? From the bottom up, they're also like this. Okay, they're not flat, they're turned this way. Okay, so keep that in mind when we're talking about positioning here. Okay, so medial border is more anterior. I'm sorry, like this. The right is lower than the left. Why is that?
Liver.
Okay, because of the liver, so it does push it down. And then the left kidney is going to be longer and more narrower than the right. Okay, so here is a cross section. Again, we're looking at it from the bottom up. The psoas muscles causes a 30-degree rotation from the coronal plane. And this is going to be significant when we're trying to put the kidney in true profile. So to visualize, let's just say if we wanted to look at the This would be the left kidney. We want to look at the left kidney. We would place the patient in what position? It's going to be an oblique because we have to oblique it, right? So we want
An
to make this
RPO?
flat.
An RPO?
Okay, so if we're looking at the left, we're going to do what?
RPO?
Do an RPO. So an RPO looks at the left, an LPO.
Because it flattens them out, right? It's gonna.
Right. So RPO looks at the left, and LPO looks at the right. So it's like this. So if we do an RPO,
It's gonna flatten.
see now it's flat. Okay. If you do an LPO, now the right side's flat. Okay. So keep that in mind when we're doing posterior obliques. Posterior obliques, we're looking at the kidney on the side up. So left, you're looking at right. Right, you're looking at left for a posterior oblique. Posterior oblique.
It's like a 30-degree rotation.
Yes, approximately 30 degrees because of the psoas muscle causing that rotation. Okay, any questions? All right, so kidney location again. The kidneys are located halfway between the xiphoid process and the iliac crest. The halfway point is at the level of L1, L2, but they do begin at the top of T11 and then all the way down to about L3. Okay, halfway point is L1, L2, starts about T11 and then down to L3. So the location may change based on body habits. The kidneys are loosely anchored, so during inhalation, it drops about 1 inches or 1 lumbar spine. If the x-rays of the abdomen are done in an upright position, it drops the kidneys 2 inches. And if it drops any more than 2 inches, then this is called Nephron Ptosis. Now, the problem with Nephron Ptosis, again, if the kidneys drop more than 2 inches, you're losing the ureters are no longer straight, so they'll have a tend to sag, causing twisting, and that might cause an occlusion of urine. So that can cause some problems of backup of the plumbing. Okay. All right. The function of the urinary system is to remove waste products from the circulatory system in the form of urine and eliminate it from the body. It removes any nitrogenous waste. Urea and creatinine are byproducts of protein metabolism. So what that means is because of protein metabolism, again, this is a byproduct that you will find in urine. One of the things that we will be checking anytime you're doing a contrast study, we're talking about iodine, right? Anytime you're doing a contrast study of intravenous iodine, we're looking at these laboratory values. So BUN stands for blood urea nitrogen, and creatinine, again, is a byproduct of this metabolism. Usually higher in males, okay, because again, we're the ones who usually eat a lot of meat. So normally, again, for males, our BUN and creatinine levels are going to be a little bit more elevated or decreased than that of the females. Okay, but this is what we look for. If you're looking at the laboratory data and you have an elevated BUN or a decreased creatinine, that usually means that there is some kind of process going on with the kidneys. So they either have some kind of disease going on, or there's a possibility that they might be in near renal failure. Near renal failure. So is that an important thing to know if you're injecting iodine?
Yes.
Okay. When you're injecting iodine, remember the last few times we were talking about the viscosity of the products. It's thicker, right? So if you got the iodine going to your kidneys are going to work a lot harder to eliminate that contrast. And if you're in near renal failure and you use iodine, you can send them into renal failure, which is a bad thing, right?
Very bad.
Very bad. And then you end up having to have dialysis for the rest of your life. Okay, so again, these are chemistry levels that we need to evaluate before we give our patients iodine. So now as part of your dialogue, you're going to say, okay, do you have any problems with your kidneys? Okay. Do you have renal failure? Are you
Do we get like a
blood?
lab result from them before we do these types
Oh,
of
yeah,
things?
yeah, exactly. So Nick just said, do we have the lab results before with these procedures? The answer is yes. And if you don't have them, you shouldn't be doing it.
Right.
Okay, you cannot do these type of procedures without having lab values in front of you. Okay, and if you don't, then oftentimes the patient will be sent to the laboratory, we'll do a stat run on them and see what their levels are. But we cannot do anything without the chemistry. Okay, so function also regulates water levels and regulates the pH balance and electrolyte levels of the blood. All right, so hilum, where have we heard that before?
Chest.
Remember last semester
Chest
with the
X-rays.
chest? Okay. So the kidneys, the urinary system also has a hilar region, and the hilum, as it refers to the renal urinary system, includes your renal veins, your renal arteries, your lymphatic vessels, nerves, and your ureters. Okay, this is the hilar area of the urinary system. Down there, renal veins are anterior to the renal arteries. Okay, so the veins are anterior to the arteries. So we intake, the average person intakes about 2.5 liters a day of fluids, and that can come in the form of any type of liquids. It can come from water, juices, anything of et cetera, et cetera. The fluids also can come from food and other end products of metabolism. So this ends up in your bloodstream. Your aorta and then your renal arteries, from your aorta to the renal arteries, the blood is streaming through the kidneys and it's getting filtered. So about 1 liter every 60 seconds flows through the kidneys. Okay, that's a lot. 1 liter every 60 seconds flows through the kidneys. And then it produces about 180 liters of filtrate within 24 hours. Basically what filtrate is the blood after it's been filtered. So it's just called a filtrate. So that's the blood that's been already filtered by the kidneys. Now what happens here is that this 99% of the filtrates gets recirculated back into your system, okay, while the waste products now becomes urine. Okay, so this is your waste products, it becomes urine, and you produce about 1.5 liters a day. Mr. Vanilla. Checking up on me. All right, any questions here? All right, so structurally, the kidney can be broken down into 2 different layers. The most outer layer is the cortex of the kidney, and this is where you're going to find the functioning portion of the kidneys. This is the nephrons. And then the rest of it is the medulla, and here you will find the renal pyramids. There are about 8 to 18 of them. Then you have the papilla, minor calyces, major calyces. So basically it starts off with just, small little funnels as urine is being produced. And then they break down into smaller funnels. And then the very last one, the urine empties to a larger type of container or funnel, and that's your renal pelvis. So this is where the urine is then collected and then eliminated by way of the ureter into your bladder, and then you get rid of it. Okay. Be familiar with the terms that we use, kidney versus renal parenchyma. Kidney refers to the structure, okay, refers to the structure, so it's a structural reference, whereas the renal parenchyma is the functional reference. So oftentimes you will hear doctors referring to the kidneys as the parenchyma or the renal parenchyma. All right, so in the cortex, this is where you're going to find the structural and functional unit. There are over 1 million nephrons per kidney, and this is where the blood is filtered. So remember your aorta, that's going to be your major blood vessel, right? Major artery. It breaks down into smaller vessels as it makes its way into the kidneys, and the very smallest part of the renal artery is called the Efferent Arteriole. The Efferent Arteriole. Okay, so then blood makes its way over here. Then you have this, this network of capillaries, okay, even smaller vessels, your network of capillaries. And this is where the filtration occurs. So red is the artery, and then blue is your veins. So this is where the activity occurs, where the filtration occurs, and then after filtration, some of the fluids, remember there's a great amount of filtrates that gets reabsorbed through the body, so that makes its way back into the vein again, and whatever's left is waste, makes its way into the collecting system of the kidneys. So this is a bigger breakdown. So afferent carries blood to the glomerulus, while the efferent carries blood away from the capsule. Okay, so as it's being filtered here, it's going to make its way through the proximal convoluted, make its way down to the descending limb. It's going to come back up on the ascending. Then you have the distal convoluted, and then out into the calyx of the kidneys. The ureters. The ureters are anywhere between 28 to 34 centimeters in length, 1 millimeter to 1 centimeter in diameter, and they sit right on top of the psoas muscles. Remember what we said earlier, the ureters are going to enter the posterolateral area or section of the bladder. And when you look at the entire ureter, there's going to be 3 areas where there are going to be normal, natural occurring strictures. The first one you will find here at the uropelvic junction, okay, ureter and the pelvis. There's one stricture over here. The next one will be at the pelvic brim. And then the last one will be at the UV junction, or the uterovesical junction right here. So you have 3 strictures. The area in which the ureters enter is a muscle. It's a smooth muscle. It's known as a trigon because it does have a triangular shape. And this trigon is formed again by the 2 ureters, the entrance of 2 ureters, and the exit of the urethra. This is what forms the trigon. Now the rest of the bladder has multiple folds, just like the stomach, and we have those folds that allows for expansion and contraction. So this folded mucosa is also called a rugae or ruga. This is something that I just added in this slide, so write this down also. When the bladder fills up, the bladder fills upwards and also forward. So it fills up and then forward. Is this significant?
Mm-hmm.
You ever do this? I gotta go pee. Your friend says, I gotta go pee, and what are you doing? You're pushing on their bladder because it's anterior.
We got it.
You got it?
Yeah.
That's gonna be on the test. What do you do when your friend has to go to the bathroom?
Punch him in his
Punch him in the stomach. All right. Why are we mean like that?
Human nature, man.
I know, right?
Entertaining.
All right. So here is a KUB with the urinary system filled with contrast. What contrast are we talking about?
Iodine?
Okay, it's iodine, right? So iodinated contrast. Would we put barium in there? Okay.
If you
So
want
yeah,
to
we
be,
wouldn't do that, right?
if you want to be mean again.
All right. So this is what happens. So when the contrast is collecting, it does cause the kidneys to light up. So again, in referring to like a KUB, we don't say this is kidneys. The more proper verbiage to use is the renal parenchyma. All right. The renal pelvis is the larger funnel, and where the urine is collected, and then it makes its way down the ureter and into the bladder. So you can see there's a couple of strictures here. You see this stricture right here, right? Okay, so there's one stricture there. The other stricture is going to be somewhere over here. You can't see it because it's overlapped by bone. It has the same density. And the last one you'll see in the back. So you won't see it in the true AP. So to visualize the UV junction, you have to believe the patient one way or the other to visualize that, okay? Okay. All right, so what do we have here? Micturition and urination. Micturition and urination, what is that? What is that all about? Okay, means act of voiding, okay. Incontinent,
Can't pee.
okay. Involuntary. Retention, inability to pee, okay. Your capacities, extravasation, okay. Extravasation. Did we talk about extravasation and infiltration? The difference between extravasation and infiltration? Have you heard of infiltration?
Yeah.
Okay, or extravasation. So extravasation is when the fluid leaks around the vessels into the surrounding tissue, okay? So extravasation can occur when you're injecting contrast because the contrast is not all going 100% into the vessel, it's leaking into the surrounding tissue, okay? So that's extravasation, but more specifically, infiltration is a bad thing because when things extravasate, you can kind of get rid of the fluid leakage by just rubbing the skin, the tissue, and putting a warm compress on top of it to get rid of the swelling. But infiltration is a little bit different. Infiltration is when you're using some type of solution that can cause damage to the surrounding tissue. Iodine does that, okay? So if you have infiltration of iodine, you really need to eliminate that solution right away or it can cause a lot of problems, including necrosis of the tissue. Okay? So that's the difference between extravasation and infiltration. All right. Urge to urinate is approximately 250 milliliters. Total capacity is anywhere between 300 to 500 milliliters. Now, that also depends whether or not you're pregnant, right? Okay. It may be a little bit less if you're pregnant and you got that baby pushing down on it. And also for men, okay, not the babies, but if we have an enlarged prostate, that will also give us the urge to want to urinate. Okay. Oh, speaking of female organs. So here is the urinary bladder, and you can see that the uterus, the uterus sits right on top of it. So during pregnancy, it's going to compress on the bladder. And look at where it's sitting too. The bladder is sitting right on top of the pubic bone. So as this gets bigger, this has nowhere to go, and it's going to press up against the bone. Okay. All right. Urethra. Is there going to be a difference in length between gender?
Mm-hmm.
Okay, so it's going to be longer in the males, right? Okay. And then here's the male anatomy. Our bladder sits on top of the prostate. So if we have an enlarged prostate, it's going to push up on the bladder, and that's why those who have BHP, which is enlarged prostate, has the urge to want to go to the bathroom and constantly going to the bathroom because of this constant pushing. Also, those who have prostate issues, look at where the urethra runs through. It's going right through the prostate. So those who have enlarged prostates also have difficulty going to the bathroom because the urethra gets pinched. Do I need to go through the other anatomy?
No.
I think we're good, right?
Mm-hmm.
That's another class. Okay. Retrograde pyelogram. So here's an image of a retrograde pyelogram. What a retrograde pyelogram is this has to be done under anesthesia. Okay? It has to be done under anesthesia. This is usually done in the OR department. So on occasion, you will be called to do a KUB on a doctor performing a retrograde pyelogram. What's pyelo? What are we referring to here when we say pyelo?
Kidneys.
Okay, well, what part of the
The renal
kidneys?
pelvis.
Okay, renal pelvis. Okay, so pyelo is referring to their renal pelvis. So what the doctor will do is they'll put a long catheter through the urethra, and they're going retrograde. So they're going the opposite direction. So this catheter goes through the bladder, through the urethra, up the ureter, and the catheter is going to sit up here into the renal pelvis. So what you're seeing here is not actually the urethra. What you're seeing here is the catheter. See how solid it is, radiopaque? And we call it a pigtail catheter because it has, the ends of it looks like a pig's tail. So you'll see it over here, and it curls up like a pig's tail right there. And the other one is in here. It's not so much in a piggish shape because the renal pelvis is causing the catheter to straighten out. Okay, but this is the catheter. So what do we have here in A? What's A?
Calyces.
So calyces. So we're going from small
The
to
majors.
medium to large. Okay. So these are going to be your minor calyces. What's next?
Major calyces.
Major calyces, and then the next one is going to be the larger funnel, which is the renal pelvis. Okay, and then it empties out through the ureter. Okay. So this is retrograde, and what they've done here actually is this catheter is in here for those who may have had an obstruction, may have had surgery. So they'll put this catheter in here to keep the patency between the renal pelvis and the bladder. So continuous emptying occurs. So they'll keep that tube in there. Okay? Here on this side, there is no catheter. But you do see the left urinary system filling up. Okay? Do you see any differences between the two? Does this look a little bit more dilated than it does over here? So when you look at the renal pelvis and it looks dilated, and also the collecting system, the calyces look dilated, that's usually an indication that there's some kind of obstruction going on here because everything backs up. Okay? When it backs up, this becomes a little bit more enlarged. And this condition is called hydronephrosis. Hydronephrosis. Okay? As you can see the ureters, but then all of a sudden, you're not seeing it over here. Right? All of a sudden it stops, but we don't know where it stops. So there may be something here that's preventing the normal flow of the urine, and it's backing up.
You can get that in the ureter as well too, right?
Say that again?
You can get that same condition in your ureter.
Hydronephrosis.
It's a hydroureter, right? Or if it gets back
Yeah,
up.
hydroureter, exactly. So the question was, can you also get that with your ureters? The answer is yes, and it's called hydroureter. Yeah, where you have a dilation because of that backup in the plumbing. All right, and then, yeah, so again, we're not seeing anything light up over here, so there might be a blockage right around here. We just can't see it.